So this is part 4, middle age. This is where I fall, ages 40 to 60 years of age. Some of the tips and risks that come here into play for middle age years 40 to 60. Tips, we want to make sure that, again, that you're coming to your professional cleanings on a regular basis. It's going to be twice a year for most people, but again, if you're one of those people that has a higher risk due to genetic factors for periodontal disease or irreversible bone and attachment loss that hold your teeth in, then you're probably going to be a candidate to come in 3 times a year every 4 months or 4 times a year every 3 months. Really, really important. Also, by the way, as you're coming in for your cleanings, you're also getting your teeth checked for cavities, tooth wear, and other things that could be a problem. Healthy lifestyle is really important. So what's that mean? Really make sure that you have a balanced diet, that you're eating well, that you are really working on habits like smoking, that you're like trying to get away from that, and as well as foods that are more acidic. And the reason this comes into play is because we want to be really, really careful about the things that could potentially cause cancer. It's one of the words we don't want to talk about, but smoking and heavy alcohol consumption can definitely make your risk of oral cancer higher. So during your visits, you should be getting an oral cancer screening. Every time that you go, your dentist should be looking. In our office, our hygienist looks and I look. So you're getting 4 sets of eyes, 2 people to look for anything that may be a change in your tissue, a bump, a lump, so that whatever it is, and we don't take that lightly, we always will have that either biopsied or sent for a biopsy. We'll have you go see an oral surgeon or pathologist just to check and make sure. Most things are not anything, but you want to catch these things early. Fluoride treatments is another tip. So typically you're getting fluoride as a child in the childhood and the adolescent ages, but fluoride varnish can be really, really important for a couple reasons. Number one, we want to reduce risk of cavities around any of the dental work that you've had, because that's a weak spot where you can have a cavity more frequently, where a filling in a tooth meet, where the roots are exposed from some of that gum recession we talked about. It's going to help to strengthen that area so that you have less sensitivity. And overall, it's one of the best ways to prevent cavities and preserve tooth structure. Now in modern day, we use fluoride varnish. So we paint it on, it's kind of sticky, so you kind of come in for your cleaning and then you leave with sticky teeth. If you're going out for dinner or something like where you need to be speaking in public, we can just do the back teeth where there's more risk for cavities. But I would always recommend a fluoride varnish treatment. It's a minimal expense. Sometimes insurance picks it up, sometimes they don't, but it's a lot less expensive to do fluoride than even to do one filling down the road. So not only from a money standpoint, but from a biologic standpoint. Every time I got to put the handpiece on your tooth, I've got to remove tooth structure. Can't ever get that back. So that was part 4 of our series, The Life Cycle of Your Teeth. This is middle age, 40 to 60 years of age. Again, lots of information. Hope that you enjoyed it and you took some tips that can help you. We look forward to seeing you for our final part 5.